For this question, I'm going to discuss lymphatic drainage for different parts of the body. Now, when you look at this table at the beginning, it may look a little intimidating in terms of memorization, but if you learn the concept, then you'll see that it's not that difficult to find out where each region of the body drains into in terms of lymphatic drainage. Now, for the ease of demonstration, I provided you with an image. I'll walk you through this, and once we're done, we will go back and fill the table together. So the first part I would like to talk about is the lateral leg and the lateral part of the foot, which through the small saphenous vein drain into the popliteal lymph nodes. Same goes for the other leg and foot. So the lateral leg and the lateral foot drain via a small saphenous vein into the popliteal lymph node. Now, as for the medial leg and the thighs, they would drain via the great saphenous vein. So via great saphenous vein, they will drain into the superficial inguinal lymph nodes. Now, I would like to discuss that the lower portion of the genitalia and the anal canal also drain into the same lymph nodes. So let's write that down. So anal canal below the pectinate line, as well as the lower portion of the vaginal canal, as well as the scrotum and labia majora, will all drain into the superficial inguinal lymph nodes. Now, as for the chest and the upper limbs, they will all drain into the axillary lymph nodes, and then head and neck will also drain into the cervical lymph node. Now, in terms of internal organs, it's easier if you know what is the blood supply to each region of the body, and once you know that, lymphatic drainage is to the same region as well. For instance, stomach is being supplied by celiac artery, and lymphatic drainage is through celiac lymph nodes. As for the distal duodenum and the jejunum, blood supply is by superior mesenteric artery, and lymphatic drainage is via superior mesenteric lymph nodes. As for the sigmoid colon, blood supply is via inferior mesenteric artery, and thus lymphatic drainage is in inferior mesenteric area as well. Now, one tricky part that I would like you to pay attention to is the rectum, and rectum is containing a watershed area. So if you remember, watershed areas are regions of the body that are being supplied by two major arteries, and since blood perfusion in these areas are poor, they are actually prone to damage in terms of decreased perfusion of blood vessels. Now, rectum is in a watershed area, so the above portion of it is being supplied by the inferior mesenteric artery, versus the majority of the lower part is being supplied by the internal iliac artery. So I would like you to remember that the rectum is being supplied by the internal iliac artery, and thus lymphatic drainage is also into the internal iliac area. So just to go over what I discussed here, the ascending colon and the transverse colon, up to the first 2/3 of it, are all being supplied by the superior mesenteric artery, versus the descending colon and the sigmoid colon, which are supplied by the inferior mesenteric artery. And the area in between is referred to as watershed area, also known as a splenic flexure in here. The other watershed area is in the rectum, because it's a transition zone between inferior mesenteric artery and the internal iliac artery. So I would like you to know that the rectum and the anal canal above the pectinate line are all being drained into the internal iliac lymph nodes. One last point that I would like to stress in terms of lymphatic drainage is that the right half of the head and the right chest and the right limb are all being drained into the right lymphatic duct. Versus the left half of the head and the left chest and the left limb and everywhere else, including the lower parts, are all being drained into the thoracic duct. Alright, now that we are done with discussing the lymphatic drainage for different parts of the body, I would like to walk you through this table and then we fill it together. So, arms and the lateral breast, we discussed that they would go through the axillary lymph nodes. Stomach goes through celiac. Duodenum and jejunum go to the superior mesenteric. while sigmoid colon goes to the inferior mesenteric. Now, anal canal above the pectinate line as well as the rectum, we discussed that they would go into the internal iliac lymph nodes. And then anal canal below the pectinate line, scrotum, labia majora, and the lower portion of the vaginal canal will all go into the superficial inguinal lymph nodes. So superficial inguinal lymph nodes. Testes will go to the para-aortic area. Medial leg via the great saphenous vein goes to the superficial inguinal lymph nodes. And then the lateral leg via small saphenous vein go to the popliteal lymph nodes. And that concludes our discussion.